Namaste. Myself, Dr. Reha Rakholia. Today's discussion topic is in vitro maturation. We'll talk about the advantage, disadvantage, safety, and indication of in vitro maturation. Let's get started. Okay, first of all, we'll talk about the advantage. See, no risk of OHSS. In IVM, there is minimal to no hormone stimulation. So this OHSS risk is completely eliminated. Now, second is lower cost. Another major benefit for IVM is its lower cost. It is more cost effective compared to the traditional IVF because there is no need for expensive gonadotropin injection. So there will be a reduction in overall cost of the treatment. It is excellent option for the patient who are concerned with financial burden. Okay. Third is convenience for patient. See, IVM is also very convenient for the patient. Unlike IVF, it does not require frequent ultrasound and blood test. And it is a kind of a stress-free process because there is no prolonged hormone stimulation also. So this reduces both physical and emotional burden of the patient, and it makes the condition more, it makes IVM more comfortable experience will be there. Okay, more comfortable experience will be there. Fourth is improve success rate. See, earlier the success rate was only less than 20%, but with new techniques, live birth rate has increased up to 35 to 40%. Now ASRM says that IVM is not any more experimental process. First, it was known as a experimental technique, but now ASRM says that it is no more an experimental technique. Okay, saves time and effort. See, IVM, it is a time efficient process. Uh, in ovarian stimulation, it takes around 10 to 14 days of close monitoring is required. Hormonal injections are required, but in IVM, no such thing is required. So it saves time, and because it skips the entire step of this, and it okay, saves time and effort. Sixth is safer for special population. See, IVM is ideal for cancer patient who needs immediate fertility preservation because it is quick. Okay, so patient who need immediate fertility preservation, IVF is a standard treatment before chemotherapy and radiotherapy, as it avoids delay caused by the hormonal stimulation, and it is also safer for women with hormone sensitive cancers like breast cancers, hormonal positive breast cancers. It is safe for those kind of cancers also because it won't increase estradiol much, so it is safe. And it is also good for hormonal conditions like endometriosis, thrombophilia, or blood clotting disorders. Okay. Additionally, it is a patient-friendly technique, and young high responder patients, it is good. Okay, because it reduces the number of embryo while maintaining a good cumulative pregnancy rate. So what are, first is cancer patient who needs immediate treatment. Second is again risk associated with cancer patients who or patient whom hormonal stimulation is contraindicated, or who are and some hormone sensitive condition like endometriosis and thrombophilia and blood disorders. Okay, A, B, C, and young high responder patient with a good prognosis. Now, ethical and practical benefits. See, egg donation programs, IVM make the process safer and easy for donor because it removes the need for hormonal stimulation. Because hormonal stimulation can sometimes cause side effect, okay, like pain, in rare cases OHSS, which can be of concern. So, by using IVM, these risks are avoided, making the process healthier for the donor and encouraging more women to participate in egg donation program. Eighth is, these are the advantage, okay? Applicable in poor responders. Okay. It is a good alternative for the patient who does not respond well with ovarian stimulation. Okay. Now, disadvantage of IVM. What is the disadvantage of IVM? Lower success rate than IVF. The live birth rate for IVM is slightly lower compared to IVF. So IVF has more stable and reliable success rate. Second is limited health data on children. See, while many healthy children have been born through IVM, the amount of research on their long-term health or on their even short-term health, like neonates, is limited compared to IVF. Some studies have noted high rate of chromosomal abnormality in embryo from rescue IVM. Chromosomal abnormality from rescue IVM. What is rescue IVM? Rescue IVM is when some studies have suggested, okay, when immature egg are retrieved during failed IVF cycle. In IVF cycle, we have given stimulation, we have given all the hormones. Even then, if we retrieve some immature oocyte, we'll mature it in vitro. So that is called rescue IVM. In that, in some studies, there was found that chromosomal abnormalities are more, okay. So, however, study shows no significant difference in both birth defect and congenital anomaly between IVM, IVF, and even natural conception. Only rescue IVM, in some studies, it was shown. This is reassuring, but we need more comprehensive research to fully understand and to fully trust this process. Unclear long-term outcome. See, we need more studies to know the long-term outcome of the IVF. We don't know the result in the children's development and malformation. Long-term results, we don't have much studies. Require expertise. IVM require a skilled embryologist, and there should be a specialized culture media, so that only some fertility center has the expertise and facilities to perform IVM efficiently. Fertilization challenge. See, oocyte in IVM, oocyte is matured in vitro. So it may be less responsible to fertilization techniques like ICSI. This was the paper in which it was given that in IVM, fertilization rate is less with ICSI. Okay. Then lack of standardization. Unlike IVF, there is no universal protocol for IVM. Clinics use different techniques and culture media, which leads to inconsistent result. Okay, which leads to consistent result. So it is challenging to interpret, and so we need an standardization of the IVM process globally. Increase laboratory workload in. What is another disadvantage is, if we use HCG priming protocol, the workload in the laboratory increases, making it less attractive for some center. Limited insurance and coverage and higher cost for patients. In Western countries, IVF is covered by the health insurance, but IVM often is not covered by health insurance. So they have to give the money out of their pocket. Expenses is more. So that's why it is now it seems less attractive to some patient, because IVF insurance, health insurance is there, but IVM health insurance was not there. We'll talk about IVM safety now. Okay. IVM safety. See, child health. Studies have shown that embryo conceived through IM do not have higher rate of imprinting issue than IVF. Means if we compare the IVF children, IVM and IVF children have similar imprinting issues. Okay. So what is imprinting issues? Imprinting disorders are genetic condition which are caused by abnormalities in the process of genomic imprinting, where certain genes are expressed only by either mother or father. If something goes wrong in this process, it can disrupt child normal growth, development, and metabolism. Okay, either father or mother gene will be expressed. Now, these are it was seen that IVM and IVF has equal imprinting issues. That means IVM is not harmful. It is equivalent to IVF if we consider the imprinting issue. Then gene expression and methylation. See, what is gene expression? You can say gene function. ठीक है, gene expression regulates how gene function. Okay, function. Gene expression regulate how gene function, and methylation is crucial for maintaining proper gene activity during embryo development. Like we say, no, if some methylation of some gene occurs, so there will be switch off that gene. Methylation will switch off that gene. Like that, it was similar to gene expression and methylation pattern was in IVM blastocysts were similar to IVF embryos, indicating that the process is safe. Now is oocyte morphology. It was seen through transmission electron microscope. It was seen that cellular morphology of IVM oocyte was comparable to in vivo matured oocyte, because in IVM we mature oocyte outside the body. That means in vitro. The maturation of oocyte is there. So we saw the morphology of the IVM oocyte, which was equivalent to, we saw morphology of IVM oocyte, which was equivalent to in vivo matured oocyte. Okay. Now neonatal health. Neonatal health and development outcome of children shows no significant difference between children born via IVM or IVF. So it was seen that neonates born through the IVM has no significant difference in development or neonatal health than IVF. Okay. What development, like neonate outcomes such as birth weight, Apgar score, okay, and term delivery, a preterm delivery, these all were equivalent to IVF. Then long-term development data, follow-up study. So long-term on children born through Kappa IVM showed that their physical and mental development are similar to those child born via IVF or natural conception. Okay, they have seen till up to 24 months, and they saw that physical and mental development of child born through IVM was equivalent to IVF or natural conception. Then these studies, we need to do more studies, and these are limited. These studies have limited sample size. Okay. So this restrict comprehensive assessment of development outcome and malformation rate. So a larger study will help provide more definite conclusion about the long-term effect. Indication, we'll talk about the indication. Okay, first is PCOS, second is poor ovarian response. PCOS, as it we have already discussed, that it reduces OHSS. Okay, it reduces OHSS, and in PCOS there are so many oocyte, so it is better for that. Outcome will be better in the PCOS case. Poor ovarian response, some ovaries do not respond to ovarian stimulation. For that, IVM is good. Fertility preservation, see, some cancers needs immediate treatment, so for that it is useful. And some cancers are like breast cancers are hormone sensitive cancers. Like we do not have to increase the hormone in those cancer. Those cancer are contraindication for hormone therapies. So in these cancers like breast cancer, we'll suggest to do IVM. Then gonadotropin resistant ovarian syndrome. In some patient, even if they have normal ovarian reserve, they do not respond to gonadotropin. So such cases will do IVM. Normo ovulatory patient. In some normal ovulatory patients also, we can do IVM if there is some financial, some legal or some social limits are there. Okay. Then rescue of immature IVM. See, rescue of immature IVM when we do IVF, but still some immature oocytes are present. So we'll do IVM for them. We'll do IVM means we'll extend the culture for them so that they get mature. Then unexplained poor qualities embryo. For sometimes when when oocyte develops, they become poor quality after some time. So there becomes empty follicular syndrome. This is mostly this occur in the late follicular stage. Okay. So we are in IVM, we are taking the oocyte before the late follicular stage. So, and we are doing in vitro maturation. So it may be helpful in unexplained poor quality embryos and empty follicular syndrome. There, because in late follicular phase, what is happening in this condition? Atresia or oocyte dysfunction is happening in these conditions. So this, as will grow outside the body, in vitro maturation of the oocyte will do. So there won't be any atresia or dysfunctional oocyte. Okay. Now, first is PCOS, as already discussed. It is particularly suited for the PCOS patients. Okay. And those patients are at, because these patients are at high risk of ovarian hyperstimulation and ovarian torsion, and thromboembolism. These three things can occur in the PCOS patient when they go through traditional IVF stimulation. But in IVM, these things can be prevented. And PCOS have higher antral follicular count, which improve the IVM success. Okay. Now, second is normo-ovulatory patient. See, IVM can also be offered to the women who are normo-ovulatory for various reasons, like social, financial reason. Some patient may want to avoid the side effect. Okay. Social reason maybe some patient might want to avoid the side effect and risk and stress associated with, okay, side effect, risk and stress associated with the IVF process. So these are the social reasons. Some financial reason, because some patient may want to are less affordable. Okay. So this is a fine choice for them because this is cheaper than IVF. Okay. So IVF in this normo-ovulatory patients are suited for when AFC is more than 5. AFC is more than 5. Good prognosis factor. Example, age is less than 36, BMI is less than 30, and AMH is more than 1.3 nanogram per ml. See, IVM, some legal condition also, legal restrictions are also there in some countries. Like there may be restriction for cryopreservation and freezing and creating more embryos. There may be restriction. Okay. Like in Germany also there is some restriction. Some Italy also there is some restrictions. And and some restriction for hormonal treatment may be there, and some religious or cultural factor may impose limit to the IVF process. Okay. So in that condition also, IVM is a better choice. Fertility preservation. I have already talked about this. The cancer patient would require immediate chemotherapy or radiotherapy. In those patient, IVM is better. Second is if estradiol, where elevated estradiol are contraindicated. First is cancer patient who required immediate treatment. Second is where elevated estradiol are contraindicate, like patient with breast cancer. Okay. and it can be conducted. See, other advantage of IVM is that it can be performed during both the follicular and luteal phase of menstrual cycle, providing the flexibility for urgent fertility preservation. Okay. Now, poor ovarian response. See, IVM is a great option for patients who have poor ovarian response in traditional IVF. The patient often shows a low estradiol level. Which patient it is helpful? The patient which shows a low estradiol level and which shows slow follicular growth or small follicle. Slow follicle or small. See, diameter is less than 12 millimeter on day 15 of the treatment cycle. Means these patients are responding very poorly to IVF. So there is reported that 37.5% clinical pregnancy rates are there in poor responders. GROS, gonadotropin resistant ovarian syndrome. It is a rare condition where the ovary is resistant to stimulation by gonadotropin FSHLH. Okay, it is resistant to that, and which leads to anovulation. And despite a normal ovarian reserve is normal. Okay. So in such condition, IVF, conventional IVF does not work. Only thing we used to do in the past was oocyte donation. Okay. Now, however, now IVM has been an alternative treatment by maturing eggs outside the body. Okay. So both genetic and immunology may be contribute to the gross mutation that reduces the function of FSH receptor, and certain genetic variation single nucleotide polymerase has been identified. Several successful live birth rate have been reported. Now, rescue of immature oocyte. See, IVM is often used in IVF cycle where there is high proportion of immature eggs retrieved. Okay, instead of discarding those eggs, IVM is allowed, and IVM is allowed to make the egg mature in lab. So there will be increased number of embryos and there will be improved pregnancy chances. Now, new novel method, new methods such as using heterogeneous follicular fluid and cumulus granulosa cell supernatant in the IVM culture medium are being developed to mimic the natural follicular microenvironment and further improve outcome. Heterologous follicular fluid is the follicular fluid. Heterologous means different. Heterologous means different. Follicular fluid is follicular fluid. So follicular fluid collected from the ovaries of different species, which is used in culture. It provides growth factor and hormone to support oocyte maturation in vitro. Now, cumulus growth cell supernatants. See, it helps in mimicking the ovarian microenvironment, natural ovarian microenvironment, so that there will be more maturation and quality of the oocyte will increase. Unexplained poor quality embryos and empty follicle syndrome. Now, in some cases, women experience repeated IVF failure due to unexplained poor quality embryo or condition like empty follicular syndrome. Okay, so what is empty follicular syndrome? Where no mature eggs are retrieved despite of normal ovarian response. So IVM help by allowing by allowing immature eggs to mature in the lab. So this this thing bypasses the process like oocyte atresia, egg death, and dysfunctional follicular development. Okay. because the small eggs are getting mature outside the body. So the oocyte atresia and dysfunctional follicular development, which was occurring in the late follicular phase, got bypassed. Okay. So this improved the chances of retrieving healthy oocyte and achieving a successful pregnancy. Now, other indications in it includes cases where conventional IVF is not viable due to the legal action. I've already told about the legal thing. Financial also I have told, and health related restriction. This point is already been covered. Thank you.